Okay, this is part 2 of Principles of Epidemiology. I know epidemiology, or epi as we call it, might not be the most interesting thing for some folks, so I wanted to break this up into a couple of shorter lectures. So let's continue talking about some standardized measures of health status. So as I said earlier, a rate helps us compare the incidence and or prevalence of a disease no matter the size of the population. So rates enable us, and other types of statistics enable us to monitor health status, to track it and to compare it. So let's take a look at some of these key types of measurements of health status that might interest us. So we've talked about in previous lectures infant mortality and maternal mortality and what that means, but we can talk about other types of mortality statistics as well. Death rates obviously are the most reliable measure of a population health status. It's usually not ambiguous whether or not someone has died, right? So we know that mortality statistics are usually of fairly good quality. And the most reliable measure, right? The degree to which people in the population die of disease is a good indication of the services provided by the public health system and the healthcare system in that area. Death rates, mortality statistics vary greatly, as we know, and there's definitely been a shift in the leading causes of death since the beginning of the 20th century and into the 21st. We've seen decreasing rates from infectious disease, although with the COVID-19 pandemic, we've seen an uptick in there. But we continue to see high rates of mortality from chronic diseases like heart disease and cancer. Life expectancy is the average number of years a person from a specific cohort is projected to live from a given point in time. And usually we do this at life expectancy at birth, right? So if you're born in a particular year, everyone in that year is assigned a certain number of years that they're expected to live. We can also do this at age 65 to get a sense of how much longer a person will live after they become a senior citizen. It's not something that we use for one individual. It doesn't describe quality of life. It just talks about how many years you have left. It doesn't really talk about the quality of those years, right? You could be at age 75 and have a life expectancy of 5 years, but you could also, for example, have dementia. So it's just a measure of the years. And so here are some statistics about life expectancy in the United States. So you could see people who were born at the turn of the 20th century in the year 1900 on average are expected to live about 47 years. Now that doesn't mean that someone who was 50 was necessarily considered a senior citizen. It just meant that a lot of people died at younger ages. Again, this doesn't pertain to one individual, it's the average for the population. And we can see that the life expectancy in the United States has gone up. Now we see that it is actually going down. Years of potential life lost is the number of years that are lost when a death occurs. So basically what we do is we figure out the average life expectancy from a person, and then we subtract their age at death, and then we get that average for a population. So for example, if we expect someone that, people in a particular group to die at the age of 75, if we have a lot of people dying at the age of, say, 65, then we could say for that population, on average, people lose 10 years of potential life. We can also look at other measures such as disability adjusted life years, and this measures the burden And we can find many sources of secondary data, right? So secondary data is data collected by other people. When we do research, primary data is any data that we collect by ourselves, but secondary data is data collected by other people, which is where we find this information, the various statistics on mortality and life expectancy and those things. So, for example, in the United States, the U.S. takes a census, counts the population every 10 years, and looks at various demographic data. The same type of census is done in Canada as well, and in other countries. In the United States, we have something called the Vital Statistics Report, which looks at major life events such as birth, death, marriage, divorce, infant deaths, etc. And this is where we get our data on maternal and infant mortality. And as I noted earlier, weekly there is information that's published by the CDC on mortality, morbidity, outbreaks, environmental hazards, and other public health problems. In the United States, there are several national health surveys that we do. We do 3 types of surveys: health interviews of people. We collect data on clinical tests, measurements, and physical examinations. And we do surveys of places where people receive medical care. So some national health surveys in the United States include the National Health Interview Survey, also the National Health and Nutrition Examination Survey, NHANES, which looks at people's health and nutritional status. We also conduct something called the Behavioral Risk Factor Surveillance System. So that looks at risk factors for diseases like smoking, sedentary lifestyle, those types of things. And all of these national data sets give us a picture of the health of the population in the United States. And similar surveys are conducted in Canada as well. One last thing we want to think about when we're talking about diseases, and you'll learn more about this when we talk about research, is understanding what causes a disease. Association does not imply causation. So just because 2 things go together doesn't mean that one necessarily causes another. In order to say that one thing causes another, there has to be a very specific type of relationship between the risk factor and the effect, right? So we know that smoking cigarettes causes cancer, for example. We can't do studies, right? It would be unethical to force people to smoke and then to follow them and see if they develop lung cancer. What we can do is look at the strength and other factors of the relationship between smoking cigarettes and lung cancer. And so, for example, we can look at the strength of the association. So we can talk about there being, the risk, being exposed to something doubles your risk or triples your risk, or, causes your risk to increase by 6 or 7 times. So the strength of that relationship, the more that exposure to something increases your risk of getting a disease, that's a key factor. Dose response is also important. So for example, the more you use of something, the more likely you are to develop a disease is also important. So if we can show that if someone smokes a lot of cigarettes, for example, or eats a lot of trans fats, for example, we should see the rates of heart disease in that population go up. We should see consistency, which is study after study should find that same relationship. Specificity means that it's clear that that one particular thing is related, that the studies are looking specifically at the relationship between two things, right? Between cigarettes and lung cancer, between salt intake and stroke, between a sedentary lifestyle and diabetes, for example. Temporality means that one thing comes before another, right? So you have to be exposed to something before it causes the disease. Obviously, you can't say that one thing causes another unless the cause comes before the effect. And another concept is biological plausibility. When we look at two things that go up together, we have to ask ourselves whether they make sense in terms of the biology. So if we're talking about things like cigarette smoking, if, inhaling all of the chemicals that are in commercially produced cigarettes, it's biologically plausible that those could damage the cells in the lungs. And then when the cells are replicating, they become cancerous, right? That makes sense. If someone claims that one thing causes another, but it doesn't make any sense biologically, then those two things probably really aren't related. So that's been a little bit of an overview of epidemiology, just a very high-level overview, some key concepts that folks should know, whether they are healthcare providers or just consumers who are interested in understanding public health statistics.